Welcome to the 5 phases of nursing process. In this section of the program, we will discuss the 5 phases of the nursing process and how they are incorporated into nursing exam questions. According to the NCLEX test plan, the nursing process thread is a major component of the exam because nursing process is the method by which the nurse will solve clinical problems and apply nursing knowledge. So both nursing course exams and the NCLEX exam distribute questions across all 5 phases of the nursing process, which will include assessment, analysis, planning, implementation, and evaluation. For this reason, it is useful for you to be able to identify stems designed to test each phase. We are going to review the specific nursing behaviors associated with each phase of the nursing process and then look at some samples of test questions that reflect each phase. Since the first phase of the nursing process is assessment, we will start by looking at assessment questions. Remember that during the phase of assessment, the nurse must establish a database by gathering objective and subjective data and identifying manifestations. This may require the nurse to take vital signs, read laboratory values, or ask the client a question. Therefore, assessment questions require you to answer questions or make predictions about what findings are expected. When answering questions about assessment, keep in mind that they are likely to include some form of the word assessment, such as observe, monitor, check, or obtain information. Remember, when assessing, be sure to focus on the issue of the question. Is the question asking about a drug, a disorder, or an early manifestation of a complication? Also, in order to make accurate assessments and interpret your findings, you must know your normal vital signs and laboratory values. Let's look at another example of an assessment question. Let's go ahead and separate the case scenario from the stem of the question by restating the question, since the case scenario and stem seem to run together. The case scenario tells us that the nurse is caring for a client who is recovering from a craniotomy for a pituitary tumor. The stem of the question asks us, when assessing for manifestations of diabetes insipidus, or DI, the nurse observes for increased. Let's identify the critical elements. The key words include assessing. The client is the client who is recovering from a craniotomy for a pituitary tumor. The issue is manifestations of DI. The type of stem is a true response stem. Go ahead and look at and eliminate those distractors. Begin with option 1, urine output values. This will be assigned a plus sign. We know that manifestations of DI is extremely elevated urinary output. DI is caused by the inability of the kidneys to conserve water as they perform their function of filtration, which leads to greatly increased urination. The amount of water conserved is controlled by antidiuretic hormone known as ADH or vasopressin. ADH is produced in the hypothalamus. It's then stored and released from the pituitary gland. DI caused by a lack of ADH or hyposecretion is called central DI. Central diabetes insipidus is caused by damage to the hypothalamus or pituitary gland as a result of surgery, infection, tumor, or head injury. Option 2, blood sugar values will receive a minus sign. This would be appropriate for if the diagnosis with diabetes mellitus. Option 3, specific gravity values. We will put a minus sign here. While you are correct that an altered specific gravity is associated with DI, a decrease rather than an increase in the specific gravity would be the manifestation of diabetes insipidus. Option 4, blood pressure values. This will be assigned a minus sign. While you are correct that an altered blood pressure may be be associated with DI, a decrease rather than an increase in the blood pressure, would be the manifestation of DI the nurse would observe for. Because we have 3 probably wrong answers and 1 probably right answer in choice 1, we go with what we know. Choice 1, elevated urinary output, is the answer we are certain is the correct option. Now, let's look at the next phase of the nursing process, analysis.